Hey, if you're watching this video, that means we did a mastectomy on you, or someone did, and today we're talking about postoperative care for mastectomy / lumpectomy. If you had this procedure done, then more than likely you have a diagnosis of DCIS, ductal carcinoma in situ, or breast cancer. If you have certain types of DCIS, we will also sample lymph nodes. Regardless, we're going to talk about both incisions, and the care for them is pretty much the same. You want to watch your incision. You want to make sure that it's not red. You want to make sure it's not swollen. You want to make sure that it's not leaking. A breast heals by filling the space up where we remove the tissue with fluid. So you will feel some gushing around if you walk upstairs. You will feel and kind of hear fluid sloshing back and forth, 100% normal. If you have swelling in your breast, again, that's 100% normal because your body is healing that space. Eventually it will go down in about 4 to 6 weeks. If you have redness in the incision or drainage in the incision, you need to give us a call. Usually we're going to call you in antibiotics if you have redness. If you just have leaking, reinforce it, put a little bit of Neosporin over the area that's leaking, and it should heal up in 24 to 48 hours. If you have a drain in place, you will have to strip the drain, and we'll show you how to do all of that care in another video, and the nurse will talk to you about that before you have surgery and sometimes after you have surgery with you and your family member so that they know how to do it. Stressful time, we know. It takes about 5 to 10 days to get an official final result on that pathology. So don't be alarmed if you don't hear from us. We'll talk to you when you come in. If you have a drain in place, you will come see us about a week after surgery. That time we may or may not have the path, and we'll talk about it. But either way, when you come in, it's nice if you bring a family member so we can talk to them about that. If not, bring them on the second visit, because breast surgery patients always get at least 2 visits after surgery. One at 1 week interval, the other one at the 2nd week interval. Swelling, numbness, tingling in your arm is normal. If you've had a sentinel lymph node biopsy, you'll know you've had that because you'll have a drain in place, and we would have talked about it before surgery. If you have some blueness around your incision and we sampled one of your lymph nodes, that's 100% normal. That's part of the process. It will go away with time. Undergarments such as sports bras will help with the pain from it moving around. Or if you wear a bra, a normal bra, put some padding in it over the incision so it doesn't cause you pain. It will feel better if your breasts have support at that time, just because of the swelling and the fluid that accumulates in the incision. That's pretty much it. If you have questions, give us a call. If you have concerns, give us a call. We'll put a list kind of up here that shows all the other stuff you got to watch out for. But realistically, thank you for letting us participate in your care, and we'll talk to you soon.